Get started in just a moment. Good afternoon and welcome to the Childhood Trauma Learning Collaborative Community of Practice session. Sorry about that. We're here today in our community of practice for the Cultivating Compassionate School Communities Healthy Knowledge course. And this session is focused on our compassionate school mental health model in social emotional programming. Today, myself, Dana Asby, the education coordinator for the New England MHTTC, and Martha Staley, the director of the School Mental Health Initiative, will give you a presentation about how to use our compassionate school mental health model in your own school mental health and social emotional learning programming. And then we'll have some questions and talk about some resources that we have for you. I'm sorry, I'm having some trouble with my slides. I'm sorry, we'd like to acknowledge the traditional ancestral unceded territory of the Wappinger and Quinnipiac nations, now known as the Greater New Haven, Connecticut area, where Martha and I are joining us today. Our funding comes from the Substance Abuse and Mental Health Services Administration. The views and opinions expressed in today's community of practice are those of the presenters and moderators, not of SAMHSA. The Mental Health Technology Transfer Center uses person-centered, affirming, respectful, and recovery-oriented language in all activities. So during this session, please ensure that whenever you're contributing to our discussion via the chat or during the question and answer session of our time together, that you use strengths-based, healing, and trauma-responsive language. Microphones are muted during the presentation portion of our time together. At designated times, you can use the raise your hand feature to request an open mic. When you are speaking, be sure to eliminate background noise, and you can also submit questions for us throughout the presentation in the chat. We're pleased to offer the option of closed captioning. You can click on the CC button to change your transcription settings at the bottom of your Zoom screen. Registration affirms your consent to receive an evaluation follow-up link via email and your consent to recording. If you experience any technical issues, please send a private chat to Ingrid Paget, our technical support manager for today's webinar. So today, during this meeting of our Cultivating Compassionate School Communities that respond to trauma effectively community of practice, we'll start out with a mindfulness moment to bring us all together. Then we'll take a minute to give introductions of ourselves. Martha will talk about our compassionate school mental health model, and we'll dive deeply into the 4 quadrants of that model and talk about how we can support youth, develop protective factors, prevent trauma, and build resiliency. Then we'll have some time for questions and answers and talk about next steps in this community of practice. So let's start out with a mindfulness moment. We're going to practice square breathing, which is a great breathwork technique that us as adults who work with young people can use to center and relieve a bit of stress, but we can also teach this to young people that we work with. So wherever you are, just take a moment to put down the work that you're doing. This will just be 1 minute, and then you can get back to your multitasking if you must. So put down the pencils, the computer, and find a comfortable seat with your feet flat on the floor. And you can use your hands with this technique, or you can just use your breathing. We're going to be breathing in through our nose and out through our mouth using a count of 4 with some pauses between each in and out breath. If you'd like to use your hand, that can help anchor you into the present moment and bring your body and breath into a stronger connection. So we're going to breathe in through our nose first, counting up through 4 as we move our finger across our eyesight of vision. So breathing in, 2, 3, 4, holding the breath, 2, 3, 4. So we bring our finger down, then breathing out through our mouth, 3, 2, 1. And holding the breath out, 3, 2, 1, as we bring the finger back up. So we're creating a square as we breathe in and out. So breathing in through the nose, 2, 3, 4, holding, 2, 3, 4, breathing out through the mouth, 3, 2, 1, holding out, 3, 2, 1. You can keep doing that breathing in, hold, out, hold, until you've come back to the present moment and come back to that calm balance point. So hopefully that gives you a strategy you can take into your work immediately and use for yourself whenever you need to come back to the present moment. So let's start out by introducing ourselves in the chat. If you could please share your name, the school or organization where you work, and its location, specifically which state and maybe city that you're in. And you can also talk about your top priority for social emotional programming. So go ahead and share that in the chat. I'll leave this up for just a second. And I'll pass it over to Martha.
Hi, everyone. Good afternoon. Thank you so much for joining us today. I'm Martha Staley. I am the director of the School Mental Health Initiative for the New England MHTTC, and I'm very happy to be with you this afternoon. And today we're going to focus on our compassionate school mental health model, which you may have seen if you have attended some of our events in the past. But this is a way that we conceptualize the work that we do in school mental health to really center the youth at the center of all of our activities. And we have conceptualized this model, which underpins all of the work that we do, with 4 quadrants. And you're going to see these over and over again throughout this presentation, so you'll become really familiar with them. But again, keeping the youth and the supports and people surrounding the youth in the center of our work. The first quadrant is about prevention, so reducing the causes of trauma and mental health conditions and stress, which has to do with evaluating systems and holding them accountable, advocating for systems change, providing resources equitably, educating and promoting wellness. The second quadrant is about supporting youth. So that might be clinically or it might be emotional support, but it's about identifying those students who might be in need of mental health supports and connecting them with resources, whether it's clinical supports or natural resources, and about delivering school-wide programming to the school community, which might happen within an MTSS framework, and about creating opportunity for students to engage with supports and talk about mental health. The third quadrant is about building resiliency, so increasing students' sense of agency, and at this point, also increasing the sense of agency for school staff and mental health staff, increasing the SEL skill set of the school community, and empowering and lifting up the voices of students and families. And the fourth quadrant is about developing those protective factors, which we talk about often as taking the form of nurturing adults and compassionate, equitable environments, and cultivating that sense of community and collaboration. So we're going to spend some time on this model and talk about how it relates to SEL programming within your school, community, or within your work in a youth serving system. And we hope that as we go through this presentation, that you will feel free to make comments in the chat, ask questions in the chat, stop us if you need clarification. And then we'll have some time at the end of the presentation to talk with you all about the work that you're doing and the questions that you have related to developing SEL programming and our own online course on building compassionate school environments. So with that, we're going to start with our first quadrant, which really is perhaps maybe the most central to our work, but that is about supporting youth where they're at, giving youth supports. And again, that's about identifying those youth in need and connecting them with resources, either individual students or the school-wide community. Next. So first of all, it's helpful to be grounded in the information that we have about youth mental health concerns, particularly as we enter year 3 of the COVID-19 pandemic. And we know that mental health generally for all aspects of our population is in a crisis in this country. We really have a secondary pandemic of mental health crises, or a syndemic. We know that the incidence of mental health challenges and concerns has grown over the last couple of years. It's gone from 1 in 5 children with a mental health concern to 1 in 4. Those who have been diagnosed with mental health difficulties are facing additional challenges getting access. The need is overwhelming. And students, our youth in this country, are really in a crisis. They've been isolated, and as you can see, half felt that they were very worried about their mental health. Over half reported experiencing stress and anxiety. 33% experienced depression, and a quarter of all students or all youth either themselves had experienced suicidal thoughts or knew somebody who had struggled with suicidal thoughts. So we know that this is a really central issue. There's a lot of need, which I know you all are familiar with, given the work that you do and the fact that you're here today. Next. It's really important to talk to students about mental health and social emotional programming, and not only talk to students. So, and this will vary depending on the age of the students or the setting, and it's important to do this in an appropriate way. But the first thing is we need to ask them. We need to engage with them in a conversation about what their mental health needs are and what the mental health needs are of the students or the youth surrounding them. But we can't just stop at the needs. We also have to talk to them about the strengths that they're seeing within their own youth community. So we need to be investigators, and we need to go into conversations with students with a lot of curiosity. And then this is something that at least the students, the youth that I know report that adults are not very good at. We need to listen. We need to listen to them in a deep and connected way and accept what they're telling us, even if it's different from what we're expecting, different from what the data says. It's important to really listen and take in and assimilate the information that they're giving us when we've asked this question. The next thing we need to do is collaborate with them, see youth as partners in this work. They're the experts on youth mental health, which I know might be anathema to some experts in youth mental health, but they're the experts of their own experience and what's going on within schools for them. And we need their good, creative, dynamic thinking to solve this issue and to create programs that are relevant and appropriate for them. We need to create a vision together for what mental health supports can be in schools. And we need to find creative ways for them to give us feedback about how that's going, to plan check-ins. And we need to be creative about that because clearly not all youth are comfortable talking out loud to adults about mental health, but there are other ways to solicit their feedback. And we need to build in choice. We need to give young people ownership and agency in their mental health and mental health supports. Next. We have spoken as a part of this initiative with young people with lived experience of mental health concerns, and what they've told us they need in schools concerning school mental health is an increased focus on the social and family environment. We know that kids are really socially motivated and socially oriented. We need to take that into consideration when we are building SEL programming and creating mental health supports. We need to focus on educator mental health, which we know is also at a crisis level in this country. We need to utilize peer support for both groups, for staff and for students. We need to look into our own assumptions that students who are flying under the radar, as we say, or being good students, well-behaved, that they're okay. Many of them are suffering silently. And we need to recognize and address the trauma that they have related to the mental health system. And not only the trauma that they have, but the trauma that their families might have related to systems in general, but also the mental health system. And what they're also telling us, we hear this over and over again, is that they are under tremendous pressure to not only cope with the same pandemic stressors that we all have, but to also move forward in their academics and try to right themselves emotionally and mentally. So we need to reduce the pressures where we can, because this is a new world than it was when we were all students, or even than it was 5 years ago. Next. One of the ways that we can support youth and mental health is by focusing on protective factors, which is the next part of the quadrant that we're talking about. And one key way that we can build protective factors into our systems is to think about trauma. So, I'm sorry, to think about collaborations. So that means building systems and environments that are compassionate, equitable, connected, but also collaborative. We can't do this by ourselves. No one group can solve this problem and deliver the supports that are necessary. We have to work together. Next. So building these protective factors are really a team effort. We need to, in order to build effective programs, all stakeholders have to work together at all levels: leadership, staff, family, students, community health providers, community leaders. We have to make sure that people understand what we're trying to accomplish, what SEL program is and what it isn't. There are a lot of misconceptions about what SEL programming or school mental health supports are. And so we really need to make sure that everybody is at the same level of understanding in order to build these collaborations and protective factors. We need to identify the natural resources and supports and the strengths of our school communities in order to build protective factors. There are strengths in all communities. Sometimes we haven't discovered them yet. Sometimes we are functioning from a place of confirmation bias or not seeing them, but we need to explore those. And we need to give voice and choice to the stakeholders of our communities. What are their needs, concerns, restrictions of all people involved in collaborations? That could be collaborations between schools and families, collaborations between schools and community health providers, collaborations between students and teachers. All groups need a voice and they need some choice about how these things are offered and how we engage with them. Next. We know from some of our other work, if you've attended any of our HEART webinars or HEART programs, which focuses on collaborations between schools and community health providers, that there are some really tried and true pieces of effective collaborations that we need to be attentive to. So we need to help staff develop positive listening and conflict resolution skills. We need to make sure that our language is person-centered, recovery-oriented, and culturally responsive. We need to seek out and leverage our community partners. Who else is in your system that is serving youth that you can partner with to help make school mental health programming, SEL programming effective and responsive to community needs? Excuse me. We need to really focus on trust and building relationships. None of these things can be done without really focusing on connected and respectful relationships. We have to identify what our common commitments are. I know we're having a little trouble with the slides, but we need to develop common expectations and commitments, but we also need to be flexible. our idea of what school mental health resource supports looks like may not meet the needs of the population or the community we're working with. We need to invest in our leadership and really support them to then be able to support the needs of their staff and students, and get creative about funding. There's a lot of discussion about funding. We offered a great webinar last week about thinking about sustainability and funding in school mental health. And we need to really engage stakeholders authentically from a place of real honesty about the realities of the world and about what we can accomplish. And I would just add, but we also, while we're engaging authentically, we also need to engage enthusiastically. Next.
Thanks, Martha.
Next, I'm going to pass it to Dana.
Yeah, and if you all could help us out by letting us know in the chat, who are some organizations that you collaborate with on school-based mental health? Sometimes we can get stuck in what we've always done and think that there aren't any organizations in our cities or states that we can turn to, and then we hear what others are doing, and that gives us some great ideas. So if you could pop in the chat some organizations or individuals even or populations that you collaborate with on school-based mental health, that would be great. I see. All right, so our next quadrant is preventing the cause of trauma. And so we have 4 or 5 suggestions for that. Evaluating our systems, so not just thinking about the education system, but all of the different systems that youth encounter, the child and family wellness systems, the justice systems, and how they all interact. How equitable are these systems? How fair and trauma-informed are these systems? And how can we push them to become more equitable and trauma-informed? So advocating for that systems change. And we know advocacy often works better when there's a collective voice. So bringing the students, the families, and the staff in to do that collectively. We also need to make sure that when we are providing resources that we do that equitably. So Martha mentioned having that culturally responsive language, making sure we're translating things into multiple languages and distributing them in various ways. Educating the whole school community on what trauma is, how we can address it compassionately, and how we can break that intergenerational cycle of trauma. And one way we can do that is to promote holistic wellness, to give our community members resources to care for their body, their mental well-being, and also care for community, do community care work. And I'm seeing some really great ideas in the chat about collaborations with universities, with local businesses, with, in California, the School-Based Health Alliance and a behavioral health organization, community mental health centers, NAMI, which is a really great organization, the National Alliance for Mental Illness. They have chapters in every single state, and they provide a wealth of programming, partnering directly with the Department of Education in your state. Opening a health and wellness school on the campus. That sounds amazing, Michelle. Love that. So a hub to help bring all of these services together. These are all really, really great idea, working with Head Start. And so when we're looking at this model, we're not thinking about these 4 quadrants as separate things that we need to do step by step. We're thinking about doing all of them at the same time. And like Martha said, we can't do it alone. We have to bring all of these different organizations together. And one thing that we can focus on when we're thinking about strengths-based, thinking about positive childhood experiences. We hear a lot about adverse childhood experiences, and now there's new research being done on these PACEs, the positive childhood experiences. So letting our adults who work with youth and youth themselves understand what kind of things can help counteract trauma or prevent trauma from occurring. So making sure that young people feel able to talk with their family about their feelings. Feeling that your family is standing by you during difficult times. Participating in community traditions. So as the school, our role might be to create some of those traditions and keep them going, sustaining those. Creating a sense of belonging, especially in high school. This all comes from some PACE's research, which you can see by clicking that link when you get the slideshow. Sage did a great paper on that. So as a school, can create these trauma-informed environments that really enhance that sense of belonging. Feeling supported by friends. So thinking as from the school perspective, some anti-bullying programming might be helpful. And then having two non-parent adults who take a genuine interest in you. So we've talked often in our webinars with the CTLC about the Red Blanket Project, which is the idea that we're looking at all the students in the school and making sure that every single student has at least one adult that they can turn to in a crisis. And if that adult does not, if that child does not have an adult, creating an intentional connection with someone so that we know that every student in our school has someone to turn to when they're in crisis. And then finally, feeling safe and protected by an adult in your home. So these are all things that can counteract the negative effects of trauma. And I'm not sure if you're familiar with PACE's Connection. It's a great online resource where you can link up with others doing this work in your local community. And they send out lots of great newsletters and articles about positive childhood experiences and adverse childhood experiences. Recently, they shared a really great PACE's tree where an individual can map out all of the positive supports that they have in their life that they can turn to whenever they are feeling in crisis. And doing that with our students can be helpful so that they have a concrete tool where they can look back in moments of pain to find those positive areas they can turn to. And Martha put that in the chat. Thank you so much, Martha. We can also look at this hope logic model to think about all of the holistic things that we as a school community can do and can educate our students, our staff, and our families about trauma. So we can think about preventing trauma from a really wide lens, thinking about the policies that exist in our states, in our schools, and also thinking about the school environment and how we can tweak things to become more trauma informed. We also need to make sure that we're partnering with families. What happens in the school building can be reinforced if we're teaching our families about what trauma is, what it looks like, and how they can use compassionate practices at home to help their children process and heal from trauma. We also have found that it can be really empowering to explain to others how trauma impacts the brain. Often when folks experience trauma, they can let that affect their self-worth and really feel like something's wrong with them or that they are broken. But when we flip that on its head and start to talk about the structural effects and changes that happen to the brain when someone experiences trauma and the positive changes that can happen when we use mindfulness practices and other trauma-informed practices to repair those areas of the brain that are deeply affected by trauma, that can help our young people, our staff, and our families feel a greater sense of responsibility and ability to take hold of their own way of moving through trauma. It's also important for us to educate others on the physical and behavioral outcomes of trauma. So not only what trauma does to the brain, but what trauma does to the body as well, and how those changes to our body then affect our behaviors, especially when we're talking about young people, their classroom behaviors. What might be known as disruption is really about connection. And we've got lots of webinars on those topics. And then finally, especially for our staff and our families, helping them connect some of the health challenges that they have currently to some of those experiences they had back in childhood, and trying to use this also as a tool when we're talking to policymakers as a reason why it's really important to focus on prevention of trauma, because this can actually help us save lives And when we're talking to decision makers who really put a high value on our economic factors, it also helps states save money when we're putting more money into preventing trauma, so that we aren't having to pour lots of money into addressing adult health effects later on. Another way that we can help prevent trauma is by teaching our staff and our students growth mindset and practicing that ourselves. So growth mindset is an idea that was popularized by Carol Dweck. She's a psychologist, and she did a lot of research back in the 90s that at that point showed that it's about a 50-50 breakdown as to whether folks hold a growth mindset or a fixed mindset. And the fixed mindset is this idea that no matter what you do, you are born with a certain amount of intelligence and skill, and nothing you do ever will change that. And we know from the neuroscience research that that's just not correct, that growth mindset is real. Our brains can change in ways that improve our intelligence and skills when we use practice, effort, the right tools, and support. So helping our young people and our staff understand that change is possible is really important. And the language that we use specifically helps instill a fixed mindset or a growth mindset. There are some really great programs and trainings out there that you can bring into your school community, teaching not just the staff, but also the parents, and then having them teach the students as well. And there are some examples of how to reframe fixed thinking into growth thinking. So I'll just give one. Instead of saying, I'm so stupid, maybe saying, I might need help from someone who's already learned this. So thinking about those positive childhood experiences, we can also help folks understand how important those are, because they really do, the research shows, have a huge impact. It increases resiliency. Those positive effects, they last well into adulthood, both for physical and mental health, and it helps break intergenerational trauma. Plus, those who have a larger number of ACEs benefit more from having positive childhood experiences in their lives. So just helping not just focus on those ACEs, but also educating about the PACEs as well. Our last quadrant is about building resiliency with effective mental health supports. So we look at that in 3 different ways. When we experience trauma, our sense of agency, that idea that we are able to make choices for ourselves, it often decreases. So building resiliency can look like giving some opportunities to increase that sense of agency, providing more choice for students and staff. We can also help build resiliency of our whole school community by increasing the social emotional skill set. It's also important for us to empower and lift the voices of families and students. So one way to do this is to implement social emotional programming school or district-wide. And CASEL has a really great guide to evidence-based programs. And some of our favorite ones are the ruler approach, conscious discipline, mind up, second step, facing history and ourselves, student success skills, and leader in me. And when you get this slideshow, all of that is linked here. So we're curious, what kind of social emotional programming have you all used? And especially tell us if you would recommend it to others. If you want to share in the chat, maybe one of these is something that you have used in the past, or if you've got something different. And we'll have a moment to speak about all of that in just a second too. And then I want to point out CASEL's wheel here for social emotional learning. It really complements our compassionate school mental health model really well, because it's talking about a really holistic view of social emotional learning. It doesn't just happen in the classroom. It also happens throughout the school building with culture and policy and specific practices. And that radiates out to the families and caregivers, but it requires that we make authentic partnerships with those folks. So taking the time and creating specific space and events for that partnership to flourish. And then broadening out into the larger community. And so aligning what we're doing in our school or district with the work that some of those community organizations and other partners that you all mentioned earlier are doing as well. So now I'll just very quickly go through one example of what trauma prevention, what all of these different quadrants look like in practice. So these come from one of our Childhood Trauma Learning Collaborative Fellows, Stacy Champy. She's an MTSS coach for Manchester Public Schools. And she has been using our compassionate school mental health model to inform a blueprint that she is creating for her district around how to make the multi-tiered systems of support trauma informed. So she's been looking at all of the various resources that she has gotten around establishing a compassionate school culture to look at how to get teams at each school to make this one of their biggest priorities. And she delivers targeted professional development around these practices and then ongoing coaching supports, because we know that to have some kind of to have long-lasting, sustainable systems that are implemented with fidelity, we can't just do a single training and walk away from it. Those teachers need ongoing technical support. So Stacy in Manchester has developed a coaching program that is a train-the-trainer model where she brings the coaches in to get aligned on this blueprint and understand really all of the things that we just talked about that are important for preventing trauma, and then provides ongoing coaching. She also has developed a school-wide mindfulness and staff wellness program, because as Martha mentioned, it's really important for us to not just address the mental health challenges of students, but the staff who serve them as well. So here's just an example of her evaluation schedules, because it's really important that we check in with those teachers, not just offer coaching, but look at the data and see how our practices are affecting student outcomes as well. For supporting youth at Manchester, she made sure that there were really clear referral pathways and that the communication to teachers was digestible and understandable, and getting feedback from teachers too, and making changes, being flexible about if it's not working for the teachers, then it's not working for anyone. So making sure that we're responsive to the needs of our teachers as well. Stacy at Manchester has also worked with the community to bring outside partners in, as well as looking at what partners within the school are available to offer supports for each of the 3 tiers. And then making sure that all of the tier 1 school-wide supports are accessible to all students. So going back to that equity piece that we talked about earlier. In the protective factors quadrant for Stacy's work, I talked about that targeted professional development. So here are 5 of the areas where she's offered that so far: positive behavior supports, relationships, cultural awareness and equity, mental health literacy, and trauma-informed practices. And she decided on those topics based off of the data that her and her team really analyzed to find out where the biggest needs were for the schools she's working with. She also started a collaboration with her city health department's neighborhood and family division, because we can't do this alone. We have to work together. And finally, at Manchester, for the Build Resiliency quadrant, she's working on school-wide social emotional curriculums with those school-based teams. Instead of developing a district-wide curriculum, they wanted to have unique curriculums that met the specific needs of each schools, because in her district, there are some schools with a wide range of diverse populations with lower incomes, and then they're with fewer resources, and then there are other schools that have more resources and different needs. So they really looked at that data again and developed curriculum that fit the needs of that school. Another aspect of the Build Resiliency supports that they're doing are self-regulation spaces in every classroom. So sometimes those are called calm corners. So just having a little space that has tools where students who are experiencing dysregulation can come and reflect and calm down instead of having disciplinary actions like detention or suspension or things like that. And finally, Stacy is developing a mental health literacy library, bringing trainings, books, resources that help her school staff better understand how to identify mental health challenges and address them in a compassionate way. So I'm going to pass it over to Martha to start us off with our Q&A portion of the day. We are funded by the Substance Abuse and Mental Health Services Administration, which does require us to evaluate our services. So our technical support manager, Ingrid, has put the chat to this very brief evaluation survey in the put the link in the chat. You can also use your phone to scan that QR code. Attendees providing their email address will receive this survey 24 hours after the close of today's event, along with the slide presentation. This follow-up email will also have links to request a participation certificate if you desire. We really do appreciate your honest, anonymous feedback, and that helps us provide information to SAMHSA and assist us in planning future meetings and programs. For more information, contact the New England Mental Health Technology Transfer Center at New England at mhttcnetwork.org. And please stay posted to our website, which is listed on the slide, for links to the video presentation and all related slides. And we also invite you to subscribe to our school mental health e-newsletter with this link at the top to learn about more resources to support mental health. So thank you again so much for being with us. Any closing words, Martha?
I just want to thank all of you for being here and for the work that you're doing to support children and families in our communities. And I urge you to take care of yourselves in addition to caring for others. So be well, and we hope to see you again soon. Thank you.